Hello again. The podcast Diabetically Speaking with SmartMove360 special episode Talking with Warriors. We started those kind of episodes for a reason because when we meet with experts, with healthcare providers, we are talking with people who are taking care of those who were diagnosed with type 2 diabetes. We are talking with people who are seeing a lot of people and they are offering them help, recommendations, suggestions. But what people who have this diagnosis, what do they feel? How do they live with this diagnosis and manage their condition? So our decision was once a month invite people who have this diagnosis, and so far I like to speak with those who've got results and are managing their condition, and they can share their success, their ways, how they got to there with others, so the newly diagnosed could get some recommendations from the inside out. So today we have Michael Roberts. He is also administrator in our group, and Rebecca Sayers. She is the nurse and also member of our group. They will be talking with us. They will be telling their story, and I am just starting right away. And I will start with Michael. Quick question, just quick introduction, who you are, where you are on your diabetic story journey.
Hi, hi everybody. I'm Michael. My diabetic journey started the first part of August 2021. Uh, it was actually discovered. I ended up in the hospital, almost septic for a totally different reason. Really severe infection, which looking back was probably a result of the diabetes. But I had no clue at that time that I was diagnosed. And the ER physician came in and said, "How long have you been diabetic?" I'm like, I'm not diabetic that I know of. He says, well, your A1C is 10.8, so you are definitely diabetic. So that's where it started. 8 days in the hospital, um, IV, vancomycin, and Zosyn running both at the same time. It was, I was so sick, it took me a few days to even think about or even start processing, the diabetes thing. But for me, that's where it all began. Um, so
All right. And where are you right now? What is your status right now?
I'm doing really well right now. My last A1C checkup was in February and it was at 5.1. Um,
Excellent.
after
Congratulations.
the diagnosis, after I got out of the hospital, I think the first time I saw an endocrinologist was probably 2 or 3 months, and at that point it was already down to 7.
Hmm.
But after that appointment, every appointment since, so after the first 6 months, every appointment has been 5.1 to 5.4. So that's where I've been running. Um, Pretty much ever since 6 months post diagnosis.
Excellent. Excellent. Thank you, Michael. So,
Sure.
Rebecca, what about yourself? Uh, Tell us a little bit about yourself and where you are on your diabetic journey.
Uh, so I am a nurse and have been a nurse for a very long time. I changed providers right before COVID. My provider retired, and I was kind of dragging my feet about getting a new one. And so finally I did. It was February of 2021. They did routine blood work, and I have the patient portal, and I was absolutely shocked when I looked at those blood results. Like, I went into, like, I wasn't even able to function at work. I don't know how I got through the rest of the shift. My A1C was right up around 13. And I just couldn't understand how that could have happened to me because I'm a nurse. And so, I felt like, not that I was, like, somebody that shouldn't get diabetes, but I did. I felt like I was somebody who shouldn't get diabetes because I knew all the steps to take in order to be able to prevent it. So how could this happen to me? And I didn't tell anybody for like 2 weeks. I told not a soul because I was in so much shock over how could this happen. Immediately I started making changes, and initially, honestly, I was afraid to eat. I was like, everything I eat is driving my sugar up higher. And, because immediately I went out and got a glucometer and, started checking my sugars. And I just couldn't believe that it was happening to me. Finally, I started telling people, and there was a ton of support out there. And I found this group, which was also really great. And, mentally, I knew about diabetes. I'm a nurse, right? I deal with diabetics all the time in what I was doing in my practice. And, it's just different when all of a sudden it hits home and it's you. So now I relate to people just on a different level because I understand there's so much more that I've learned. I took the nurse educator course from the American Diabetes Education, ADCES. And, I just have just delved into the research and learning more and more. So I did get my blood sugars under control, not as good as Michael's, but I have had my A1Cs in a really good place, and they stay that way. I have the freestyle, which I asked for immediately, and it is just such a blessing because I knew I wasn't going to stick my fingers long term, and so it's nice because it holds me accountable to what my blood sugars are doing. And I think right now my average blood sugar runs around 130, and that's pretty much where I stay.
All right, thank you. And this is something that I am observing, and I think Michael will uh, back me up on this. When I am looking at profiles of people who are joining our group, there is such a big percentage of nurses. And I can explain, I mean, I'm suspecting many of them had similar attitude that this will not happen to me because I know about it. But one thing is to know about it, and another thing is to do something to prevent it. And we all know that nurses and all medical professionals, they are so overworked that, as always, caregivers look at themselves at the very last minute, the very last people who they take care of themselves. And that's how I attribute. I have my sister pretty much in the same boat, who she is taking care of everyone, and the last person who is she looking at is herself. And as a result, her blood sugar is not where anybody wants to be. So not as high as you found, but still not where the person without diabetes would have it. So thank you for sharing. And this is one of the reasons why I wanted Rebecca to join us on this, because I want people who work in medical field to pay more attention to their own health. This is so important. Michael is a social worker. He is working also with other people, helping them out, including people with diabetes, helping them out to find the classes, helping them out to find the care, not even thinking that he is not immune to this. This is something that type 2s, this is something that all of us are pretty much walking, how do you all get it, if we don't pay attention. So we've heard your stories in short, and just to repeat, how long did it take, Michael, for you to get your numbers into where you have it right now?
Excuse me. Um, what I'm trying to recall exactly, but it was within my numbers was under six within 6 months.
Mm-hmm.
I was discharged from the hospital. Um, I was in there 8 days, so it's somewhere around the August the 8th, I think. And it was October, if I'm not mistaken, was the first appointment I could get with an endocrinologist. Um, and at that appointment, it was somewhere around 7, I think.
Mm-hmm.
And then December or January when went back, that's when my numbers were under 6, down like 5.4 is,
Okay.
and they've been consistently there. Um,
I
I
see.
credit, for me it was getting on the right medications early that really helped
Mm-hmm.
me.
Mm-hmm.
I discovered really quickly that I was not going to be someone that could tolerate metformin. Um,
Mm-hmm.
so the next thing that I went to was Ozempic, which I was on, and I think that was a tremendous benefit for me personally, and losing a lot of weight. That had a lot to do with it, and it didn't even take as much effort to lose the weight once I cut out the sweets. That was what really giving up the sweets. I mean, I started dropping weight quicker than I thought I would. Um, I still struggle with pasta and potatoes at times, but very limited. I think the diet changes it helped tremendously, but it was just something that the diagnosis never really scared me, and it probably should have. I've had family members with diabetes. I've had family members that have died from complications of diabetes. But being a medical social worker, I was familiar with the disease, and I realize that it's a journey. It's a choice you got to make. You can continue to make bad choices. You can continue bad habits, but you will, without a doubt, greatly shorten your life. And for me, that was. I hope I didn't stray off topic, but that's how I done it, and that's how I continue to do it.
Okay. Good. Thank you. And so about 6 months. The reason I'm asking this question, and thank you for letting us know what helped you. And Rebecca, I will ask you a question. The reason I'm asking how long is because, as Michael, you know, and Rebecca, you probably also saw those questions multiple times in the group. People saying, how can I lower my blood sugar quickly? And the answer is there's no way for you to lower it quickly. It's like I need to take care of it ASAP, like a week. Like
Yeah,
there
I
is
mean, you
no
cannot do
way.
it instantly, and that's going to depend on how much you adhere to limiting your carbs, cutting out sugars. I mean, that's the only answer. I mean, your A1C, it'll change a little bit. As we know, that's just 3 months average. It's going
Yes,
to take at least 3 months of you really paying attention to your intake and what you're putting in your body before you're going to see any numbers. And people's bodies all react differently. Rebecca can probably speak much better to that than I can, but it might take some people 6 months where other people can do it in 3, you know?
exactly. So Rebecca, what about you? How long did it take for you to get your numbers consistently at the level where you are right now? What helped you to get there?
I want to say probably it was 6 months as well,
Mm-hmm.
right around there. Initially, I went extremely low carb, and I knew immediately I needed to move more. And so, we're very busy, as nurses. And of course, this is in the middle of COVID. And so there was I was, I'm a nurse leader. And so I'm, managing a team through this, very stressful crisis. And yeah, so moving at work, but that's very different than just getting out and moving after work. Because you know what, moving after work helps to reduce the stress. I loved on the expo, how he had brought up that, stress is a release of, cortisone, glucocortisol, I think is what and so it makes sense that, stress, that cortisol is driving up the blood sugars. I think a lot of people I've seen in the group, have talked about, being diagnosed And they call it COVID diabetes. And really, I mean, think about the stress level that so many people have gone, and that just drives up the sugar. So for me, it was the eating. And then after I had it under control, I started like gently, slowly, testing, okay, what carbs can I eat? And my blood sugar is going to be okay. Like one of the things I learned for me, no matter how good I'm doing, right, I can't ever eat rice because rice just shoots my sugar way up. For other people can do it, right, but I can't. And that is the thing about the eating as well, is it's very individualized. It depends on where the person's at with their insulin resistance. It depends on how far along the journey, how responsive their cells are to being able to get back into that space. Some people can do it just with diet and exercise and getting good sleep and having a good stress management program. Other people, they need to add medication into that whole regime. And sometimes it takes playing around with the medicines to really be able to get it into a good place. And so there's so many factors to be able to look at to help get it into that right place.
I'm glad you
Absolutely.
said that because I preach it every time I'm on any broadcast. Don't shame anybody if they need medications. Don't tell anybody you can do this without med. That's just not the case for everybody.
Right.
Everybody's body is different. Some people can, and that's great for them. But I don't like medicine shaming at all. If it's working for somebody, that's just one of my peeves, and I bring that up every time I'm broadcasting anything pretty much.
Yeah, my sister, she is also diabetic, and she went through medication after medication after medication. Now she's on insulin, and you know what? Now her sugars are finally controlled. So rather than thinking about, oh, you can do this without medication, I applaud her for sticking with it so that now she's running really great blood sugars and being that committed to her health to go through that journey and get to that place. And
Mm,
so that I think is really what it's about, is just commending people for taking action.
absolutely. And if as we know from people who are reporting to the group, our another Carrie, she was on the previous show with Warriors, sh- people who consistently working towards changing their lifestyle, making healthy changes in their way how they live, really eat, move, sleep, what they do to improve their situation overall, they can actually get off the medication or lower the dosage or change medication from stronger to not as strong if they staying on task, if they working on it. And that's something that we always, and Michael and myself and Rebecca, thank you for chiming in. We are always are saying medication is not a evil. What we all know, doctors can help prescribe you medication. Nurses can helping you out. The next step is for us to take these steps, use the tools, and work on ourselves. Right. So something that
Absolutely.
we got to remember. All right. Quick question. What was your biggest aha moment on your journey? And Michael, let me start with you since Rebecca was talking just now.
My biggest aha moment. I I think it was well, there was a couple. I mean, getting my Dexcom was tremendously beneficial to me. That was a big, huge help. Um,
Just a second. For those who doesn't know what he's talking about, it's continuous glucose meter. This is
Yes,
something that,
it's like the Libre that Rebecca was talking about. It
yes,
continuously monitors your blood sugar, and you can see it on your phone 24/7 real time what your numbers are at that time. That
yeah.
that was a huge for me, and that really helped me to be able to, like Rebecca was talking about, to be able to adjust my diet and slowly add carbs back in, because I agree with what Rebecca said earlier. Starting at ultra low carb, I'm like, this is not a lifetime, this is not something that I'm going to be able to do long term. And that was another aha moment, was this is not a sprint, this is a marathon. I'm going to be dealing with this for the rest of my life. I can go full out and eat 10 carbs a day, but how long am I going to be able to do that?
Mm-hmm.
And then then you're going to crash and you're going to fall off the wagon, as they call it, and be in a really bad place again. And the best thing for me, that aha moment, was when I went to the endocrinologist and my numbers were so much better. And I thought, I can do this.
All
With the
right.
CGM, with adjusting, I can still have some foods in moderation that I enjoy. I don't have to give everything up.
Mm-hmm. All right. What about you, Rebecca? What was your biggest aha moment?
I think that there was two actually. One of them being the continuous glucose monitor, because you can't ignore that, right? And so
Sorry,
there's,
guys, I've
you
got a
can't just
visitor.
be like, uh, it doesn't matter, right? Because how many times are you going to look at that blood sugar climbing and finally you're going to be like, okay, you know what? I really need to just make a change. And
Mm-hmm.
it's a journey, right? This isn't something that's just short term.
Yes.
So, sometimes like I moved from New Hampshire to Maryland, and it's taken me more than a minute to be able to get back into, a regime and, a lifestyle that works. The second one, honestly, is how much physical movement impacts our blood sugar. Like, I even know to the point that now I was working with a dietitian and she told me that, exercise is like a low dose of, metformin. And I've like, I'll check my sugar. I'm sitting watching TV, before I go to bed, and I can see that it's starting to go up. And I literally will like do some form of vigorous activity for 5 minutes or less. And I will watch my numbers automatically start to drop. And
Wow.
so the impact of that physical movement, of that physical activity, I mean, it's just impressive to me, how much that actually in the real time, like, I started taking, the metformin, and it took like felt like months for it to start
Uh-huh.
doing something. It really wasn't months, but it felt that way, right? Because I wanted immediate results right now.
Yes. Yes.
And so the exercise is pretty cool because that you actually see your numbers drop right away.
Absolutely. Thank you. This is something for everybody to remember. If you are pre-diabetic or diabetic, if your numbers are big, it's not that you have to go and do a lot of running or or break the sweat, but even just walking in a very comfortable pace will help to lower your numbers right away, as Rebecca mentioned. All right, I'm big on movement. Smart Move 360. What can you do?
I thought
Make a
you'd like
move
that
and make it smart, right? Anyways, two more questions. We could mash it in one. We have few minutes left on the show. One suggestion that you could give to newbies, to those who just got that dreading phone call from doctor's office saying, hey, your blood work shows that you have diabetes. What one thing you can recommend them to do? What will you say to them? And Rebecca, we'll start with you.
I think breathe. Really, you know what? Breathe, because it's overwhelming. And so then you're going into, like this panic crisis mode, because it is a crisis, right? When you're not expecting it. And we're not helping it at all when we're in that space of the crisis. And so, really just take a minute, do those nice deep breaths, because it turns off that stress response. And if you do that nice deep breathing, it activates the parasympathetic nervous system, brings on that sense of calm, and then you can be in a space to rationally uh, say, okay, these are the steps that I'm going to take.
All right, thank you. I love that. Michael, what about you? One suggestion for newbies who just got this diagnosis.
Well, she took the best one. I would absolutely agree. Just stop. Don't, take a breath. Uh, Another, don't stay away from Google until you get to talk to some medical professionals. Stay away from Google because it will scare the bejesus out of you. You go in there and you Google like diabetes symptoms, and you're going to get pictures of amputations and people on dialysis and all these worst case horrible things that can happen. First thing, stay away from Google. Get an appointment if you possibly can anyway with a nutritionist.
Mhm.
Start your journey there. Um, but stay away from trying to figuring out on your own.
Absolutely, definitely. And that's one of the reasons why I started this group, Diabetes 101 for Beginners, trying to bring everything down to basics. Because until you know the basics, it gives you nothing to know all the details of all the complications that are possible. You got to know the basics, have understanding of it, and once you've done that, you could start actually try different options as long as you're checking your blood sugar and positively thinking positively. I am going to do that. Okay, few more minutes. Well, 4 minutes. And the question is, you both are caregivers in addition to being diabetics. But what can you recommend to those who have the spouse, the family member who they want to help, but they are not diabetics themselves? What suggestion you could give to caregivers, how they can be effective, helpful, what they should know? And I will start
Num-
again with, okay, Michael, go ahead.
okay. Number one, don't get upset with them. Don't be angry with them. Try to be supportive. Don't tell them what they can and can't do. It's in your approach and it's in your tone of voice. Be compassionate, be kind, understand, and be thankful that that's not a place you're in and something you have to deal with, and understand that they are human. They're going to make mistakes. That's just the nature of, I mean, that's just the nature of being human. We're
Hmm.
all going to make mistakes.
Yes.
So that's most important to me.
Good. Thank you. Thank you, Michael. And Rebecca, what will you recommend to supporters, to caregivers, what they need to know, keep in mind when they are trying to help those who is diagnosed?
I would have to say, be gentle and celebrate the successes. It's so easy to be in that space of being frustrated because you know in your head what you're supposed to do, but doing that in your heart or physically speaking isn't as easy. And so celebrating the successes is positive reinforcement. And so really, capitalize on that because you want that person you're working with to feel comfortable communicating with you.
Excellent.
And so then it keeps it as a more positive place for that communication.
Great
Absolutely. If
suggestions.
we know our A1C is supposed to be under 6. If somebody goes from 8 to 7.3, celebrate that with them. Don't say why are you not under 6 yet.
Yeah,
As long as you're going in the right direction, like I said, it's a lifetime. If it takes you a year, as long as you're headed in the right direction, praise people for that. Support them for that.
excellent. Well, thank you, Rebecca and Michael. We went through the list of my questions. Thank you for being so open and willing to share your point of view, your knowledge, your information. We are wrapping up right now. I wanted to say thank you everyone who listened to this podcast. We just had a diabetic healthcare expo last weekend, and Rebecca was speaking there, sharing her experiences and knowledge and expertise. We are going to have one again in May, last Saturday of May. And every Thursday at 4 p.m. Eastern, we have this show, Diabetically Speaking with SmartMove360. Dive in, tune in, listen to it. We are promising you will not be sorry for those 30 minutes. Have a great day. Thank you, everybody, and see you next week.